Hello.
Hey, Bellator Society. Hopefully, you can hear us. We're using a microphone and a different camera for this second installment of Corona Like a Catholic.
Yeah. Hopefully, last time I was a little embarrassed. We couldn't get our tech set up right. So we had our phone sideways on her computer. So you're like, well, how can you actually see the keyboard of the
And
computer?
how can we see if someone's going to ask us any questions?
Right.
It was
That's
very
true.
complicated.
So
So
anyway,
we think we have it figured out this
we've
time.
got some better stuff
Maybe
logged
we have
in.
it. Yeah.
So anyway, hope everybody is having a good day. We thought we'd get back together again because
Yeah, things have changed a little bit.
we've had a lot of stuff going on this past week since the last time we got together.
Yeah, we've had a lot of questions come in. After our last live stream on how to Corona like a Catholic, we actually got a lot of great feedback. But we also started to get texts and questions and telephone calls saying, "Hey, so what do you think about this?
Oh,
what do you
yeah.
think about this?" So we started
Like
to
a
make
lot of
list.
personal questions like, do I take this trip XYZ?
Yeah,
So it's been a lot of questions. So we've gotten a lot of interesting. So I've been trying to do research.
Yeah.
I actually was reading today, and I kept reading, and I kept reading, and I kept reading. I finally came out, and I told Fran, I was like, I don't think I can read anything more about coronavirus today. And she said, no. Go back, read some more. We're going to live stream
Don't
tonight.
stop reading.
Don't stop reading.
Don't
Keep
fail
going.
us now.
Okay, all right. I'll read some more. So,
And in his defense, he actually did just get off of what was it? Like a conference call?
I did.
How many doctors were on that call?
There were nearly 4,000 ER doctors on this live stream that we just wrapped up about 20, 30 minutes ago. So it's good to hear other docs have all got the same questions that we do, and everybody's kind of still all struggling with the same data set of information.
Right. So everybody's still processing, but what I have come to feel is that there is a disturbance in the force. My spidey sense tells me that there's a disturbance in the force. So we're going to look to you for you to tell us what is different. But actually, before then, on a scale from 1 to 10, how annoyed are you that I used disturbance in the force and spidey sense?
Spidey sense together? Quit mixing your universes. That's really awkward.
Awkward.
All right. So what's different, I think, especially today, and I think the reason today's a good day to come and chat is, as everyone's probably already heard, the WHO made a announcement today that the new COVID-19 kind of disease has hit the pandemic level, and they've officially categorized us as in a pandemic. Now, we talked about this last week. I said last week that pandemic was coming. We weren't there yet, but that what that would mean when we reach that pandemic level is simply how widespread the spread of this illness is. Not necessarily that this disease is more severe than any other diseases out there, because there have actually been more severe versions of coronavirus previously, but those more severe and deadly strains of coronavirus that we've had in the past were just never as easily spread as this one is. And so now we've hit that point where we know that it's spread throughout the majority of countries around the world, and pretty much every country and region has got some coronavirus. And so that's why they've kind of changed gears and said, hey, we're in a pandemic, and I think everybody is looking to some of the countries who are really struggling right now to kind of take cues on kind of what should our response be.
Yeah, because I just read Italy's guidelines now are basically wartime triage for caring for patients. Why is that?
Right. Well, and that's because the rate of rise of cases in Italy has risen so quickly that they really have exceeded their capacity to take care of patients in the routine way that we do. Yeah. So we have pandemics previously of illnesses. We think about H1N1 as being the last major kind of pandemic that we had. I mean, we have seasonal pandemic flu, every year, or not every year, but many years we'll have that. But the point in many of those is that we never exceed the capacity of our emergency departments and our ICUs to take care of patients. But when you have a very large spike all at one time, there is difficulty in some regions, and we're seeing right now a lot of terrible stories coming out of Italy that they are struggling to make decisions of basically triaging and managing limited resources for some of their patients there.
Like, what does that mean? I read the word patients with comorbidity are
okay. So
tell me what that means.
Well, I have 10 ICU beds in my hospital, but I have 15 patients that need to be intubated. So who do I decide gets to stay on the ventilator and who can't be on a ventilator? And so they're having to make decisions. Is it the people who've been on the ventilator the longest? Is it the people who have the best chance to survive? And so when you have limited resources in a mass kind of casualty situation, there are decisions that are made based off of who has the best chance of surviving, and that's who may likely get the ventilator as opposed to the people who are at least likely to survive.
Okay.
Those are hard.
That's hard.
Those are hard.
That's
and so that's
stuff.
what people are dealing with. And
these are really moral things that doctors have to deal with.
So last week, and over the past couple weeks, I have been very cranky and have been a bit of a naysayer.
He's been very cranky.
When it came,
it's also Lent.
Right, and I've been fasting, so that makes me crankier. But I have been a bit cynical when it came to some of the measures that people were suggesting. And, when I heard somebody had closed a school or somebody
said
wasn't
the word draconian.
I did. And I was
know
like,
what
this
that
is
word
ridiculous.
means.
And I was like, that's
a literary term. I know what that means.
And so I was frustrated because I felt like much of these recommendations were given out of a sense of panic and fear, with no real thought to whether or not the costs of these measures outweighed or were less than the benefit to the public health. So I've amended my thoughts a little bit in this past week. And so that's kind of, as Fran heard me talking, she was like, I think we need to podcast again. So I've amended my thoughts in some bit. And I actually reposted a great article today on my Facebook feed that was talking about a really good argument for why would you do some of these measures. And here's the point of a lot of these measures. We're not looking... When we shut down schools, when we do some major things, and we close, I heard March Madness or something wasn't going to have, I heard maybe they were not going to have any fans at March Madness or something like that.
Really?
Like maybe the games would continue, but there wouldn't be any fans allowed in the stadium. Yeah. Anyway, that was something I heard today. Not sure how true that is. But when you do that, is the point of that truly to decrease the number of total people who are going to be ill from this virus? And the answer is no, we're not, because this virus inevitably will spread, and many of us will get this illness.
Like statistically, between, what did they say?
I've heard 60 to 80%.
Wow.
Of the population might be infected by the virus. But in general, I don't want to cause panic, and I don't think we should panic because we still don't have a clear idea of how severe it is. And we'll talk about that later. But the point I wanted to make as we kind of get started is that these measures, these kind of control measures that are out there, the whole point is to, again, not to decrease the total number of cases that would be out there, but decrease the spike in the cases. So if you can stretch the incidence and the onset and the first wave of the illness, if you can stretch that out over increased weeks or months, then when you have sick patients, you haven't overwhelmed your healthcare system. Right. And that's what Italy's dealing with right now, that they have more intensely ill patients than their ICUs can deal with. And if we can take some measures, yes, the same number of people are going to get sick. We still may have 60, 70 million people in the United States get sick from this. I'm totally throwing that number out there. That's a made up number. but they're still going to be sick over time. But if they don't all get sick at once, then we can handle it. We can take care of the sick ones when they come through.
That's what it means to flatten the curve.
Right. So that's the argument.
That's the terminology.
You'll hear that, and a lot of people will say flatten the curve. So instead of having a large spiking curve of illness, you've stretched it out, and so you don't.
So we're like slowing the roll.
Right. You slow the roll of coronavirus enough so that the healthcare system can keep up with the sickest of the sick, so that when the people who are high risk get ill and they're in respiratory failure, there are open beds for them to go to.
Okay, so I'm going to go straight to some of the questions that we've received. I know you have some notes that you want to get to.
I have my notes. You have your notes. We'll see who wins.
Exactly. It's always a competition here.
Who gets all of their points said?
So one of the questions that we got was, is it smart for all of these schools, like here in Nashville, Vanderbilt, but then like the county schools, our children's schools, like we're having schools close preemptively prior to spring break early, but then through spring break, and then all of the children are being told, bring home every single one of your books just in case, because we might have extended break. So do you think that's smart? Do you think that's going to be an effective?
I think at some point in the continuum of this disease process, that is the right there is the right choice in that. And it's is
it now? Is it later?
Is it now? Is it later? Yeah. That's what you just don't know, because you've and even the CDC, there's a great portion of the CDC website on coronavirus. If you guys want to go, if you actually do like a web search for like CDC mitigation strategies, they have a whole page there that really talks about what are things that we can do as either small business owners or school principals or family members. What can we do? What kind of things? How can we alter our behavior to flatten the curve? Again, that's the whole goal here. We're not trying to isolate this illness. This disease is out there. It is spread. It's going to spread. We can't stop that. But if we can mitigate the healthcare system from getting overwhelmed, how do we do that? So closing schools is one thing that can be done, but there's also multiple other steps that can be made. I mean, like the CDC website, when it comes to schools, they talked about, well, maybe you stagger when recess is, and so all the kids are not playing together at the same time. Yeah. Stagger their lunches, or just change the start times of the day for certain classes so kids aren't in the hallways at the same time. I mean, there's all sorts of things that you could do that's in that middle area. So there's the one side of the curve where you're doing nothing and you're just thinking about it, and there's the other side of the curve where you shut school down.
Right.
But there's also plenty of things you can do in the meantime. So yes, shutting a school down is one way to go about it, but there's a cost to that.
Absolutely.
There's a cost to the families. There's a cost to education. There's a cost to the mental health of our children. I mean, there's cost to that. And so it's not that it's wrong to do that. It's, are we there yet?
Right.
I feel like some of the school closings that have happened so far have been a bit of a jump the gun.
Right.
That we weren't quite there yet. But
well, like a week ago,
it's not unreasonable.
A week ago, you didn't want to be the person without enough toilet paper, and now you're like, you don't want to be the person to stop school too late.
Right.
Like you don't want it. So I mean, it's almost like, again, you're a little bit, doing things more than what might seem reasonable, but you don't want to be the person who did nothing or not enough, basically, is what you're saying. And I want to say, we just did get confirmation that the NCAA did announce no fans at tournament games, so that's
March Madness. Sorry, folks.
And I guess that's what, basketball?
Oh. Wow.
Sorry.
Fran knows her sports well.
Is it basketball?
It's basketball. Okay. Well done, love.
Thank you. Look, I knew what a pandemic was.
There you go.
I'm winning some way.
So I'm not against. I think that our leaders and our public health officials, we need to be thinking about what are the things that we can do to lessen the burden and the spike of the illness. But we also have to remember that there are costs to all these things that we're doing, and we can't go overboard. We were talking, although the doctors tonight on the podcast or the live stream were talking about. I mean, he was like, pick your poison. Like you can either do too little and the disease runs rampant, or you can do too much and you crash the economy. Like you can be criticized either way you go. You just have to remember there's a balance and try to strike that middle ground.
Okay, so in trying to find the balance and strike and looking for the middle ground, like what are some things that we as the individual can be doing? Well, actually, let me backtrack a little bit, because we did get one kind of pointed question: is how are people catching the coronavirus? Is this airborne? Is this surfaces? Like what? Like we were talking about a lot of the things that people are telling us to do, like wash our hands, wash surfaces, and now they're saying stay away from large groups of people. So what? How are people actually catching the disease?
Catching? So coronavirus, what we know about this specific coronavirus and coronaviruses in general is that the predominant way that we're getting spread is what we call droplet spread, droplet contagion. So when you cough, you have these large droplets of fluids that have the viral particles in them, and those things hover in the air very briefly from minutes or so in a very short range around you, and then they kind of settle down onto the surfaces. So in one respect, if you're right up on somebody when they cough,
once again, this
like
is probably
you're sharing a
little
microphone,
too close for comfort.
Then as they cough, some of those airborne particles you could breathe in, or they could get into your eyes or something like that. But that is not the biggest way of the spread.
Okay.
The main spread is then contact. So those droplets that have settled down onto surfaces, or they've either they've contaminated their hands and they've touched the surfaces. It's us touching a surface after somebody else has, and then you can't get sick just by having the virus on your hands. So
because it can't go through your skin.
It can't go through your skin. This virus is not going to go through your skin. So if you wash that off, you don't get the virus. But if you don't wash your hands frequently and don't use any hand sanitizer, and you've got the particles, and then you reach up and you touch your face and you pick your nose and you pick your teeth or something like that, that's how you get infected. So the main spread is those droplets that have settled on surfaces, and then you basically put that into your mouth or to your mucous membranes in some way. The very minimal way is what we think of airborne spread, truly airborne spread, where this virus is floating in the particles kind of out there. And so somebody 20 feet away or in the next room over might get this illness.
Or like on the same airplane as you.
Right.
Or
that's minimal.
Okay.
That
we don't
really
think that's really the way.
We don't think that's the main way that's spreading. But we do know that being in very tight, close quarters with a lot of people, that droplet spread happens a lot more easily.
Yeah. If nothing else, someone might like cough on your jacket, and then you take your jacket off and you've touched. So,
and you're all together. You're all touching the same stuff. Yeah. So I mean, but it's not necessarily that it's truly what we call airborne. So that's why they're actually talking about decreasing the stress on folks using N95 masks. These are the masks that really filter out the smallest particles, as opposed to like a general surgical mask, which is when you cough, it kind of catches that stuff. They're actually moving away from saying that we really need to be focusing on N95 masks and more of just making sure we're hand washing. A surgical mask over the patient, a surgical mask over us is probably okay when we're taking care of.
When you see patients, you're gonna use one of those like full screens over your face, like a big plastic thing.
Like some people have
like
the
if you're
things.
Welding.
Some people have those. Some people have
that?
one that have like an N95 mask that has a plastic visor that kind of goes with it.
You're probably going to use that.
It'll be whichever one we have in the ER.
But it's probably going to be a welding thing that maybe covers like even down to like your waist.
But I bought those cool ones. I bought some cool little glasses that are stylish. I gotta be stylish when I'm taking care of my coronavirus.
My goodness.
So that's the transmission, and just so that we know, this currently, from what we can tell, it is more transmissible than the flu. It's more contagious than the flu is for a variety of different reasons. But it has a combination. There's that innate characteristics of the virus itself, as well as our immune system response, has set it up that this is a little bit more contagious than the flu is.
So when people have said, and I think maybe even you said, like it's similar to the flu.
Right.
You meant like in terms of like
how it spreads.
Right.
how it behaves. I mean, it is different. I'm not saying it's exactly the same as what I still think for
it's
most
still
folks,
a good comparison.
people
for
understand
our brains.
what the flu feels like, and they understand how the flu spreads, and so I think it's very similar to that in many ways. But it is. I mean, it's different in other ways as well.
Right. Okay. So the next question that I have is, should I open windows to my house? Like, is that going to help if somebody in our, like, say someone in our family were to would be tested positive for coronavirus?
Opening the window in their room would be great.
Because I do that for like stomach bugs and everything.
The more
anyway,
turnover of air, the more those droplets in the air go outside. And settle outside, and then the UV radiation kills them. So, I mean, the more airflow you have, the better, and that keeps your environment better. I think I do want to say I did read some interesting stuff just recently about just kind of the clinical course of the flu. Yeah. And I wanted to bring that up because, as we're talking about it,
what does clinical course mean?
Meaning, what do your symptoms look like? How does it start? When does it start? And how do you look throughout the course of the illness?
So what you should look for and how long this might last.
Exactly.
Over the course of the illness.
Right. So in terms of how it's similar to the flu, there is a lot of body aches and kind of general malaise and cough. So that's very similar.
Malaise means tired.
Tired, lethargic, just worn out. So that's very similar to the flu. But what's different is the flu hits you like a hammer real fast right up front.
It does. Like every time I've had the flu, I know who gave me the flu. Like I feel it. Like the last time I had the flu, I think I got it at like one of those jump zone places. And I remember sitting at the table watching my kids jump on like trampolines and getting like a tickle in my throat.
And that's called psychosomatic.
And I'm sure that I got it from the trampoline park.
That is not quite possible.
So it hits you really fast and you know where you got it.
So, but it does. But when the symptoms hit, it hits strong. Within the first 24 to 48 hours of the illness, you know that you're really sick.
Yes.
Now, here's what's different about coronavirus, though. Coronavirus, you have this kind of body aches and cough and general feeling of tiredness that seems pretty mild for about a week of the illness. Now, let's go back. I'm sorry. Let me go back one step further and just say how long from when you're exposed to when you get sick.
Yeah.
Okay, so they're saying about the median time of exposure to getting sick is about 5 days, but it can be up as anywhere from like 2 to 9 days, maybe even up to 10 to 14 days. But
so you would
in
not
general,
know
5
that
days.
you were sick.
You would not know that you've been exposed.
Okay.
You wouldn't know that you have been exposed and the virus is replicating. Correct. You would know that you're sick.
Right.
For 5 days after being exposed.
Okay.
In general. Okay. And it is possible, just like any other virus out there, that you can actually be contagious before you show symptoms. That's all viruses. That's
sleeper cells.
That's not anything new. So I don't want everybody to think, oh my gosh, the coronavirus is so different than everything else. Many viruses do that. Yeah. But so let's say 5 days after you're exposed, you start to get what seems like a mild flu-like illness with the body aches and a cough and maybe some low-grade fever. But really, for that first whole week, it doesn't seem a whole lot more worse than a regular cold. So then at that point, what happens after the first week of illness, either it fades away and gets better, and all you had was a mild illness, or the folks who are going to get the severe respiratory failure and like kind of bilateral viral pneumonia that we're seeing, that's all going to happen at like day 8, 9, or 10 of the illness. So it's the second week. So just because you looked well in your first week doesn't necessarily mean you're not going to be somebody who gets sick in the second week. And I only go to say that is just to say there are so many people out there that probably have those mild symptoms.
Well, because it's like it's spring. Everyone has a sniffle. Everyone has a cough, kind of. Like we're walking around in the world with allergies, seasonal allergies. How do you tell the difference?
I mean, if what you have is allergies, probably what you're going to have is more of a runny nose, sneezing, itching, watering eyes, and that's not the symptoms of a viral infection.
I know that is upper respiratory.
That is upper respiratory, and typically that's either going to be your regular old rhinovirus or allergies.
Okay.
On the other hand, when you have kind of generalized body aches, fatigue, and cough, those lower respiratory generalized symptoms, that's probably either going to be the flu or possibly the coronavirus.
Right.
But you should probably be, if you've got mostly runny nose, itchy eyes, sore throat, you can assume that that's probably not coronavirus.
Okay. Well, what is row? What does that mean?
So I found out it's pronounced R0.
R0?
R0. Some people had said row, but it's R0.
What is that?
So that was something I was reading about today in terms of how contagious an illness is.
Okay.
And I thought it was interesting because, it's a number. It's kind of a coefficient that tells you what is the likelihood that if you're sick with coronavirus, how many other people are likely to catch it from you. So if that number is 1, every time you're sick, one other person's going to get it, and this virus kind of continues. If that number is below 1, then eventually this virus kind of dies out. If the number is above 1, then we know that the number of people are going to slowly increase as time goes by. So they're saying right now that the R0 value for this illness is somewhere in the 2 to 2.5 range. So for every person who gets the illness right now, about 2 to 2.5 people are picking it up from them.
Really? Wow.
So you can see that it spreads when it does that. So there are things that we can't change about that. Well, because there are other viruses that are much higher. Measles, on the other hand, way up there in the 10 to 15 range of R0. And so highly contagious that one person will give it to 10 to 15 people. The R0 value of coronavirus, like I said earlier, is slightly higher than influenza.
Okay.
And partially that's because we have some latent immunity. We have some
because we've never seen it before, right?
To influenza we've seen before,
Yeah.
and so we have some immunity. Whereas this one we
Right.
don't have much immunity there. But they were showing that what can we do? So if this R0 value is whatever it is, what can we do to affect that? And that's human behavior. Because they showed, like on one of the cruise ships where everybody got sick, the R0 value for coronavirus on the cruise ship was 15.
Wow.
And so you can see when you're in close quarters, and you can see when you're rubbing up on everybody, and you don't have the ability to, I'm sure they ran out of hand sanitizer, when everybody's locked up on these quarantine cruise ships, it spread very quickly. So there are things we can do to change the rate of infections by our human behaviors.
Which is why the schools are closing.
Right. I mean,
which
that's
is why people are being told to stay home if you feel sick.
Back to flatten the curve.
Okay.
There are things we can do to flatten the curve. Again, it's not about panicking, and it's not about me and you nervous about whether you and I are going to get the infection. It's about how does our healthcare system deal with everybody, and how does our community deal with it. So it's, and I just...
Gosh, I needed a shield.
There goes...
Where's my shield?
There goes Corona right there. Sorry, love. We knew you were going to catch it from me eventually anyway, right?
It really was inevitable.
We knew that was going to happen.
Okay, so here's my other question. So this is a real case scenario that was asked of us. Say that there is a parent at a school who has been exposed to a patient with coronavirus,
Right.
okay? And then the school shuts down.
Right.
If you have a child who maybe doesn't go to that child's school, but who plays with that child, should you not play with the child? Should you quarantine your family?
No.
Isolate your family?
Right.
Okay. Also, let's stop there. Actually, before you even answer that question,
Okay.
What is the difference between a quarantine and an isolation effort?
Perfect. So that's a very good question.
Because I use them kind of interchangeably, and I think that's probably wrong.
And a lot of people are right now.
Okay.
So think about isolation in terms of a patient who is sick.
Okay.
And who has a diagnosed illness. We are confirmed you have coronavirus. So what I'm going to do is I'm going to isolate you right now so that while you're healing from this illness, you don't spread your illness to other people.
Okay.
That's isolation. So that's what you do with a sick person.
Okay.
Quarantine, on the other hand, is what you do with a person who you are worried is at high risk, and you suspect may have been around somebody with coronavirus. So they don't have the disease.
Okay.
They're not showing any evidence of the disease. They're happy, healthy people walking around.
Okay.
But we're going to limit what you do right now so that in case you have the virus and you haven't shown any symptoms yet, were spreading it. So there's a difference. So quarantine is what you do to healthy people. Isolation is what you do to sick people.
Okay.
And in general, in previous infections of specifically coronavirus, we've had 2 major outbreaks of coronavirus in the past 20 years. One was SARS and one was MERS. And in both of those, isolation of infected people and quarantine of close contacts was enough to pretty much stop those diseases from spreading. They were actually very severe in terms of, like, I think MERS had like a fatality rate of like 50%. Like, I mean, it was crazy. So I mean, this coronavirus is nothing like the MERS that we had before. But that MERS was not highly contagious, and they were able to use isolation and quarantine to kind of shut it down.
Okay.
So when isolation and quarantine don't work, when it's exceeded that, that's when you start using the social distancing stuff.
Oh, so that's what we're doing now is the social distancing.
So we're not talking about isolating or quarantining close contacts anymore. What's happening when you shut a whole school down is social distancing. That's people going the next step and saying, I'm moving beyond close contacts here, and I'm doing something different.
Because it was getting so crazy. It was kind of like this like 6 degrees of Kevin Bacon thing. Where like, did you know somebody who knew somebody who knew somebody? Like at some point, everybody's going to know somebody who knew someone who knew someone.
Right.
So the social distancing is the answer to that.
So
maybe.
But there's like, in any question of the social distancing, there's cost and benefit. So I'm not saying it's right or wrong.
But that's what we're doing.
That's what they were doing. But you're exactly right. If I'm exposed to a patient who I was known coronavirus positive, and my kid goes to a school, like, what are the chances that your kid that goes to that same school as my kid, I mean, the chances are very, very remote that has played out that way. And so in a reasonable isolation and quarantine situation, you would not shut the school down.
So on one hand, nervous mamas and dads should not be so worried. Like, we shouldn't be like fretting
we should not be fretting about our individual children that they are going to get sick.
But maybe we should be tolerant of these measures that are being taken just because they might be done in prudence. Maybe they're more than we need, but like, again, who wants to be that guy?
Right. And it may be that it helps somewhat. But it also, we have to understand what the costs are.
Okay, we have another question that I would like clarification on the difference between monitoring and PUI, meaning persons under investigation. Does it mean that persons under investigation have symptoms of the virus? What is a person under investigation?
So a few weeks ago, persons under investigation, in my opinion, had a very strict term to it. And persons under investigation were people that we felt like met the level of criteria that needed testing. So, for example, someone who was symptomatic and had just traveled from China, or somebody who had been exposed to a positive patient and who was symptomatic, or somebody who was in the hospital in fluid respiratory failure without another diagnosis there. These were patients who were like, we think this patient has coronavirus. They're a patient under investigation. And then what we would do is we would call the health department who would help us decide, does this patient need to be tested? So that's what a patient under investigation is. Somebody who you are highly suspicious has the coronavirus. On the other hand, there are people who might be a contact of a contact.
Again, that Bacon's Law situation.
Kevin Bacon's 6 degrees. The friend of a friend who maybe the health department is saying, you know what? You traveled to a place that was level 2 on our list, not level 3, but level 2,
right.
and maybe you should just kind of self-monitor yourself, or maybe you should quarantine yourself just to be safe. We don't have any reason to be highly suspicious, and we're not going to come and test you.
But it would be nice.
But it'd be nice to be monitoring you, and why don't you monitor yourself? So I feel like that's probably the difference. Now, though, in the past week, the patients under investigation, the PUI, has changed enough that it's really up to the discretion of a provider, a physician or nurse practitioner who's taking care of a patient to decide who is a PUI now. It could be, since there's community spread, it literally could be anyone at this point.
How do you know who to test? Because, I mean, like, again, I'm hearing, like, from every direction, like, we need to test everyone. And then the other side is, why are we testing again? Like, unless we have a reason to test. I mean, is it for statistics that we're testing?
So
or
I'll talk about it in two ways. Number one, I want to talk about the test that we have.
Okay.
So let's talk about how this test is a PCR viral test.
You're gonna bring it down.
So
bring it down to right.
It's a swab that is looking for proteins that are a part of the virus. That if we could test it, and then they do this thing where they amplify it and they figure out, do you have any of these proteins there? PCR tests are in general very good tests, but they're not perfect, and they're not. So we have no idea. We truly, like tonight, that was a big part of the discussion. We have truly no idea how accurate any of these tests are.
In that we don't know what's false negative, what's false positive, those sorts of things.
We have no idea.
Okay. Because it's so early.
We don't have a gold standard.
Yeah.
You only are able to compare to a gold standard to know how do we know what the underlying rate of this illness is in the community? So if I swab you and your test is positive, is that a false positive? Is that a real positive?
Right.
It was negative. Is that a real negative? Is that a false negative?
Well, I think there was a report of one patient at a school who went home, was tested, got a false test, and then maybe a week later,
was negative, and a few days later, for whatever reason, was tested again and was positive.
Right.
So there are some estimates that people are saying that maybe 70 to 80% of the time when you're truly positive, your test actually comes positive. So there's like a 25 to 30% false negative rate in these tests. So that's just saying we don't have a perfect test. So everybody says, I want to be tested. I want to be tested. I want to be tested. Well, if you get a negative test, does that mean you don't have coronavirus?
Right.
No, it doesn't.
Does that change your behavior?
If you get a positive test, does that mean you have coronavirus? Probably. Are you going to do anything different now that you know?
Well, I would isolate. I
but
know
you
that I would
be doing
isolate.
That anyway.
No.
If I'm
sick.
If you're sick.
Right.
If you're sick, you should be doing that anyway.
Right.
So there's three reasons we would test people. Number one, we're doing it. Three reasons we would test people for a specific disease. Number one, it would be if there was a treatment for that disease. So if I know you've got strep throat, boom, I treat you with an antibiotic and I fix you. That doesn't really work in this case because
there's nothing to do.
There's nothing to do about it.
Yeah.
So we kind of throw away that reason for testing. We're not testing it because it's going to change your treatment for you. It doesn't. The second reason we would test patients is for kind of infection control, so that we know that you're sick and we isolate you so that we protect other people. So that's reasonable. That's a pretty decent reason to do that. But we also know that there are many, 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 many more people out there who've got this illness who are actually not going to get tested. And so that's helpful.
Yeah.
But then the third reason we would test is for general surveillance, to understand how prevalent is this illness in the community, so that we can make some of these social distancing measures, these mitigation things that we can do on a social level. And I think that's helpful. I mean, it's how are we going to make reasonable decisions about closing a school or not having attendees at March Madness without knowing how prevalent the disease is. So, I mean, there are reasons to test, but for an individual, for you who are sick, does it matter to you if you have a positive or a negative test?
You're still going to do the same thing.
You're still going to do the same thing.
You're still going to isolate. You're still going to wash hands, open windows,
Right.
do all of the cleaning that needs to be done, the preservation of other lives.
Right.
And I want to say this. You were saying some really serious things just a second ago, and your chair squeaked, and it maybe sounded like something inappropriate, and it wasn't. It was your chair.
Squeaky chair. Notice she didn't take the squeaky chair. She gave me the squeaky chair.
I didn't laugh.
Let's undermine the physician in the room. Thanks a lot, Fran.
I kept it very chill, but I just want to say if you heard something.
So,
it was this chair. Okay.
what other questions you got for me?
I just have a couple more questions.
Okay.
The next question came from our Facebook page. How will you prepare your home if someone falls ill? How will you keep sanitation and isolation? And what would be a plan to follow in large families? I identify with this question.
So I don't think I mentioned my fantasy last week, did I?
No. No.
that I have been.
Do you want to do
I was
that?
so.
What is your
I have
fantasy?
had this strange fantasy that I would catch coronavirus, and that you would lock
That's
me.
a fantasy?
It was because then you would lock me in my room and I would binge on Netflix and play video games, and you would bring me a tray of food every day, and I would just like be cozy in my bed. So it was kind of like a little fantasy that I was kind of looking forward to this. Yeah.
Okay,
So back to the real question.
Back to the real question
Okay.
and the real answer. I think that this will be like a mutual decision. I mean, obviously, we're going to be talking. If someone were to fall ill in our family, we'd come to terms together
Right.
with what would happen.
Well, so first
Because
off,
I shoot really high for standards.
even for a stomach bug, the
Yes.
poor children in our family are on the sick blanket.
Sick
and
blankets.
You're not allowed
They're
to
a
move
thing.
off the blanket.
Nope.
Here is your corner of the house, and you cannot move from it.
That's right. Don't get off that sick blanket. If you have to go to the bathroom, let me know, and I will escort you from the sick blanket to the bathroom. That's what happens in this family.
Yeah.
But in case of
this, okay, so
yeah.
let's say you are officially diagnosed with coronavirus. Number one, the state health department's going to be involved, and they're going to give you recommendations on what to do. But what I have been reading about in terms of what are the general recommendations for somebody who's supposed to be on self-isolation is basically that a person who you're concerned is ill would need their own bedroom, private bedroom, and a private bathroom, and that they would really need to stay in those two rooms, and that we would try to minimize contact with them during their isolation period, and that'll be as long as the state health department tells you it is. Right now, there's not clear data on when somebody stops becoming infective, that when they can pass on the illness.
Wow.
They're doing tests right now to see when people stop shedding evidence of the virus, but that can be weeks after they stop showing the illness. And that's
Wow.
not necessarily when they stopped being possibly infective to other people.
My goodness.
So right now, it's a pretty delayed course of self-isolation. And again, people are you basically want to just keep them isolated. So you would need to keep children away from the other children, and they need their own kind of space and room.
So that, again, in our house, that would also mean leveling up in terms of like cleaning things and disinfecting things like doorknobs, toilet, bathroom items that people would use. Hopefully we would be able to send someone just to one bathroom to use themselves. But if someone has to go to the bathroom, someone's got to go to the bathroom. Would you really say go outside? No.
And I would have some requests of things that I want on my food tray when you bring it to the door for me.
You would.
I have a list.
Do we throw away everyone's toothbrushes? What's that about?
Ooh, that's interesting. Nobody's made any recommendations about that yet. In things like strep throat, where we frequently give the recommendation of while you're taking your antibiotics for strep throat, you should throw away your toothbrush and get a new one during that antibiotic treatment so that you don't reinfect yourself from your toothbrush. I have seen that multiple times. In this, though,
I do that even again for the stomach bug. Really, for anything, if I feel like you've been sick, you're going to get a new toothbrush.
I don't know in this case when would be the right time to do that,
Yeah.
because we don't know when you stop being infective.
Yeah.
When you stop shedding active virus. So would you change it out a week into your illness, 2 weeks into your illness?
Every day?
When would that
you change
be?
the toothbrush every day?
Now,
I'm just
part of it,
kidding.
though, is with this virus, you will likely not catch the virus again.
Oh,
We have seen that you do get personal once that second week of illness kicks in, your immune system is actively
It knows
attacking
what it's
that virus.
looking
It
for.
knows what it's looking for. And so I'm trying to think to myself, even if I had some virus left on my toothbrush, I've got that active immunity now. Probably it's not a big deal,
but
because
probably I'd throw it away anyway.
but by the time, don't share toothbrushes with
For
somebody.
sure not. No. Also, here's another thing. I don't think that this is a recommendation from the Academy of Pediatrics or any doctors, really, but it's going to be mine. That if you have someone that's sick in your family, especially a child, up the screen time. Because you don't want all those kids to be playing with Legos and Play-Doh and sharing
Up
markers.
the screen time?
Yes. You know what? You can watch any show you want to watch.
Okay.
Not video games, because I would not want them to touch put their hands on devices.
You're watching shows.
But I would turn on
the
some
AAP
Netflix.
would not be happy with that.
This
We'll
is
have
where I disagree with the AAP.
We'll
Once
have
again.
a whole generation of children who've survived coronavirus, but they've ended up being, brainless zombies who watch too much TV. I guess. I don't know. I guess. All right.
I think that screen time might be a good way to just to maintain sanity, actually, during the coronavirus if you were isolated. I mean, what else would you do if you had small children? I'm just putting that out there. Oh, we've already said this, but this isn't after someone has been infected. Well, I mean, you could do that then too, but like this is the thing that I was talking about last time we
is it focusing?
I'm not seeing. Okay, so it's called Mavala. Anyway, it's just like it's the stuff that you put on your nails, and it says Mavala Stop. Help avoid putting fingers in your mouth. This is what people need. This is what people need to buy stock.
You paint it on, you paint it on the nails, and then when the kids start to put their fingers in their mouth, it tastes really foul. Yeah. Used for helping stop biting nails, but
it's good for training.
I think it's great now during this season as well. Like if you're somebody who can't keep your fingers out of your mouth on a general basis, paint your fingers up with that. It'll help keep you well.
I forget what the statistic was, but I was reading something that said that most adults are like, I don't bite my nails. I don't pick my nose. I'm going to be just fine. But then when they're actually like looked at under a microscope, like you can touch your face, like, I don't know, 60 to 80 times a day. If I don't even know if that's this. But it's like so many more times than you would ever imagine. So I also think that if you like have nose hairs that grow kind of long, maybe you should trim them now so that if they tickle your nose, you don't touch your nose.
Do you see how she's looking straight at me when she's talking about your nose hairs are so long?
There are some people out there.
They're so disturbing. You need to trim those now.
I don't know who needs to hear this.
You were literally looking at my nostrils as you said it.
Next question. Should we not travel? You have gotten this question no fewer than I think 6 times from people that we know and love in the past week. So should we travel?
No one is. I mean, obviously, President Trump this evening made an announcement about travel bans, overseas and to many European countries.
Coming from European countries, except for the UK.
How helpful is that going to be? Well, we're in a pandemic, right? Mm-hmm. We've already hit the point where this is in pretty much every country. Mm-hmm. So does enacting a travel ban actually stop the spread of this illness?
Maybe might slow the roll.
Maybe it flattens the curve a little bit, and that's probably what they're going to try to do. But anyway, so right now, do I plan on limiting our domestic travel at the moment? No. We've got a couple trips lined up for the summer. Haven't canceled them. We're taking, we're doing some road trips here and there, and I don't plan on stopping any of that.
Is there anything that would happen? Just, and I know that potentialities are always like, you can't think of all of them.
When would I say?
When would you say, like, what, we're just gonna stay home?
I'm not there yet. I don't know. I don't know. I don't feel like
fair.
I'm there yet. I feel like.
Well, here's one deal. We're about to go to a funeral, which is going to be filled with people from all over. Are you at all nervous about that?
No, I feel I'm not nervous about it because I feel like the pros of doing the thing we're going to go do is way more important than the risk of possibly getting sick right now.
Okay.
Do I feel like that me going to the funeral this next week is going to overwhelm the healthcare system? I was like, I don't feel like it's an irrational or irresponsible thing to do to gather in this case.
Okay.
Now, would I right now go to a CME conference where, to go to some educational conference for fun because I'd like to learn something new? No, probably not. I might just schedule that for another time. But am I going to not do the things that I think are important to me and my family? I'm going to keep doing those things.
Okay. We kind of already talked about this, but like severity, again, I just kind of want to reiterate, like we've talked about, like, it's not just like the flu, but it is kind of like the flu. So how much more severe would you say it was?
So,
is severity the right word?
It is, yeah. Okay. I mean, well, and they talk about, the sciencey term for it is case mortality. So of the cases of documented COVID virus, coronavirus, what is the mortality rate? And those numbers have varied pretty greatly from country to country. In countries where we have very low screening, so we're not testing a whole lot of people and we're only testing the most severe, that mortality rate is very high. In countries like South Korea, where they are testing thousands and thousands and thousands of people, very widely, they have a very, very low case mortality rate. So the more people you are testing, the more likely you
kind
are
of dilute
you're diluting it down.
okay,
You're getting a real denominator to it. As we're speaking right now, the officials that I have heard are estimating will probably land somewhere in the 0.5 to 1% kind of mortality rate for this virus, which, to put in perspective, again, influenza virus is about a 0.2%. So this would be somewhere between five times, maybe as high as 10 times. So 5 to 10 times as severe in terms of mortality rate than influenza is.
Okay.
And that's the best we know at this point. Now, right now, when you exceed the capacity of your healthcare system, like what's going on in Italy right now, it goes up because the people who you could provide good supportive care to, you can't. And so that's what we're trying to avoid. That's when you get a very high spike in people dying from the illness, is when your hospitals get overwhelmed. So in addition to what can we do on a public health kind of setting to do the social distancing, keeping our distance, decreasing congregations of people, all those things. I think that's great. But the other thing we can do is don't go to the hospital if you're not super sick.
That was actually going to be one
Like,
of my questions.
I wanted to get to that.
What is the right protocol? Okay, so I'm sick.
Yeah.
I have a fever. I have a low grade fever. Say it's about 100, 101. Is that low grade?
Sure.
Okay. I have a cough. It's not terrible, but I do have a cough. I feel kind of achy, but I mean, I'm not. Any other given year, I might be like, I'm going to stay in bed today, and then I'll get up tomorrow, and I'll go about my business after I've taken a couple of doses of ibuprofen and get the fever under control. But now my behavior changes.
So, as a pediatric ER doctor, unfortunately, probably 60 to 70% of the patients I see throughout the wintertime are that exact scenario. Kid's got a fever, got some runny nose, got some cough. Let's go to the ER. And that is the wrong choice. It's the wrong choice in a regular scenario. In a regular winter, I do not recommend people are seeking care for what seems like viral illness because there's no treatment that can be given. And especially right now, the last place for two reasons that you want to be if you're not severely ill is the hospital. And for two reasons. Number one, for you, because if you don't have coronavirus, you've now put yourself at high risk of getting the coronavirus by going to a place where sick people are congregating together. So for your benefit, don't go to the ER.
Okay.
Number two, don't go to the ER because we have other patients there who are sick with other things. We have patients with congestive heart failure and chronic lung disease who are there.
Or immunocompromised with cancer.
They're there for some other reason.
Yeah.
And now you have brought your either regular virus or coronavirus up to the hospital and make it more likely for those people who are at high risk to get sick. So if you are a healthy person.
Look at the camera and say this.
If you are a healthy person, your child is healthy, you are healthy, you have no major medical problems, and your symptoms are fever, cough, runny nose, sore throat, malaise, anything like that, you don't need to go to your pediatrician, you don't need to go to your primary care doctor, you don't need to go to the ER, you need to stay home. You need to do what is right for our public health and keep your infection, whether it's the mild rhinovirus or it's flu virus or it's coronavirus, you need to keep your infection at home to save the rest of the people from getting ill and to decrease the load on our healthcare system, because we do not need ERs full of people with mild illness demanding to get tested, a test that's not going to do them any good, and clogging up the system when we have other people, the normal people who are always sick, and then we've actually got some coronavirus patients who are sick.
Okay, so back to testing though. So say that I think that it probably is coronavirus though. Like I'm not like. On one hand, I'm not sure, but I think I have been in touch with someone. It might be like, should I call the health department?
So a lot of people
how
are
is the
recommending.
testing done now?
A lot of the recommendations are try to figure out a way to do a telehealth visit.
Oh, okay.
So if your physician's office does email visits or maybe has some sort of a kind of an online on your, use those ways to access the healthcare system without doing face-to-face meetings. So that's step one. If you have any way to access healthcare without doing face-to-face visit, do that. That way you can get good advice from a provider. You know, if worse comes to worse, again, you're mild, but you think you may have it, isolate yourself. Just make the decision to go, I'm just going to stay here for, 2 weeks until I'm over this, and I'm just going to shut down. And, there's recommendations for, you might look into how are you going to get your groceries delivered, if you're going to be on isolation, kind of make some plans along those lines. But I am not in the camp of at this point. If we had a way to do tests that were not through our healthcare providers, like not through the emergency department, if like South Korea and the UK have done this, they have like drive-throughs.
Like a drive-through coffee place?
Literally, you can do like a consult on your phone.
Yes.
And you answer some screening questions, and then you get an answer, drive to this location. You drive up in your car, you open your window, they stick the thing up your nose.
And then they hand you a latte.
And you get a latte. And
genius!
Wait a minute. Hold on. I'm pretty sure combining food prep with a COVID virus testing station would be a bad idea.
Okay, that would not be good. It sounds good. It sounded good.
We'd shut down.
Okay, never mind.
We'd get shut down pretty quick. But that's what they're doing. Okay. And if that were the case, I'd be all for as many people getting tested as possible. But right now, when the only way you can really access this test is by going to an emergency room, I'm not in favor of everybody who wants to get tested getting tested.
Well, I think I read that the patient zero, that's the right term, patient zero, the first patient in Williamson County.
Oh, here?
Here called and was met in the parking lot by a health provider.
Right. He did
to
not
do the swab. He did not go to the ER.
Right.
He called and was given instructions about what to do, and
and then self-isolated.
And that seems really reasonable to me. Like, I get being worried. Not everybody lives with a doctor.
Yeah.
And even when you live with a doctor, sometimes you look on Facebook at other infectious disease doctors that you know in the world, and you find out what they think about things.
You mean you second guess my advice to you?
Not always. But just like, here's the deal. Not everybody has that luxury. So some people need reassurance.
Right.
The right way to receive that reassurance is a telephone call or an email. And then asking, what's my next step?
And I think we've got room to improve there. I think I wish I had really good advice for somebody to say, so if I don't want to go to the ER, how do I get tested?
Yeah.
I don't have really good advice for that yet. I think that's going to be state by state, depending on what the departments are doing, and things like that. But I don't think we have that set up here quite yet.
All right. And interesting, did you have anything else that you wanted to say? Was there anything else
other things just to think about? The last thing I think I wanted to mention that was on my list was just talking about what are the risk factors for severe disease. So let's say, again, you're healthy, your children are healthy, great, but who in your family really should be cautious right now?
And
so,
does that mean quarantining now?
Well, I wouldn't say full quarantine, but I would say they should be thinking about what they're doing over the course of their day. Do they go to Bunko tonight? Are they going to go and
do they keep a nail appointment?
Right. Are you going to do the little luxuries that normally you wouldn't think much about, but right now maybe just be a little bit more cautious. And that's folks who are older. So certainly 65, 70 and above are at high risk for complications from this virus. Anyone with a history of coronary artery disease, so heart disease, heart attacks, hypertension, diabetes, and chronic pulmonary disease or kidney disease, chronic kidney disease, like somebody who's on dialysis. Patients with these type of what we call comorbidities or diseases that put you at risk for complications, if you've got family members who fit that category, then they should be making some prudent decisions about their daily activity. The rest of us can probably go on with life fairly normally right now, but I would say
I can still let my kid go on a bike ride around the neighborhood. That's not going to be a problem.
We're in the phase certainly right now where I think high risk patients should be looking at their daily activities and saying, what things can I cut out to make
Can
me
I
more
learn
safe?
how to do Kroger Click List?
I think we should.
I think we should. We've never. This is going to come as a bit of a surprise to some people.
Because you love the grocery store shopping.
I love the grocery store shopping. One time we had a friend who was selling like a grocery service, like I don't know, was it a mail service or something?
Yeah,
I forget what it was called. But anyway, they were like, you can just make a list of like all your hair products, your soaps, your cleaning products, and it'll just be delivered to your house regularly. And I'm like, then how will I smell every bottle? That I know that's the kind of shampoo that I want.
She loves spending the time on the shampoo
I want to pick out my meat. I want to pick out my apples. Like, I really love the grocery store, and yet I do think that we need to make a run, like make an order for Kroger or Walmart
just
or whoever does the delivery service, and just see if it works for us. Because maybe we'll love it. Just number one, and number two, we might need it.
So I want to put my final plug in again one more time. I'm not at the place that I'm in. I'm not afraid. I'm not afraid of this virus.
You're also an ER doctor, and you're hardly ever afraid of anything.
I'm not afraid of.
You're trained to be not afraid.
That's true. I'm not afraid of us catching this illness because I think eventually we probably will.
Sure.
And so I'm not living in fear of that. I'm not going to be making choices that are about how do I keep myself from getting sick. I'm going to wear this N95 mask when I go to the library today, I saw that today.
Did you?
I did.
I
saw at the library. She came into the library wearing her N95 mask. I'm like, that's not how I'm going to live at all. But what is keeping me up at night a little bit is thinking about, what is it going to be like that day when I'm in the ER and I have a sick patient and I don't have an ICU bed for them? What is that going to look like? And are there measures that we as prudent individuals and as socially responsible and moral people can do to protect the other people who are at high risk?
Yeah.
You and I may not be high risk, but there are other people who are, and what are the things that we can do to help prevent their illness?
Right. I think that what you're getting at is the Christian mission of imitating Christ in sacrifice. Like, we don't get to live everything that we want. We don't get to do everything that we want, because we do have to look out for, in love and in charity, our neighbor, and figure out what is best for them as well as ourselves.
Right.
We have to love our neighbor as ourselves, and that's a hard thing when, again, we're making little fine tweaks to our lives that might not be just for us. They might be for other people. Am I going to go visit my parents down the street if we all have coughs and we have a little fever, but I gave them some Tylenol? Like, probably not. Like, that's probably not.
We do prudent things right now.
We do prudent things right now. Exactly. Was there anything else that you had to say?
That's it. I got most of my stuff done. If more stuff comes, if I've got some friends who are infectious disease doctors out there. If I said anything totally wrong, I'm sorry. I'm trying to do my research. I'm trying to give you all good information. But yeah, give me feedback if y'all heard anything that you feel like might not be right on the money, or if other questions come up. I know some people are watching the video and have been putting in questions as we're talking, but other folks may be watching this after the fact, and so. Happy to either do this again if more questions come up, or try to clarify as need be.
One thing that I did read that was really helpful for me, and just kind of encouraged us to do this live stream again, is that one of the greatest combatants to this or any sort of pandemic or panic situation is communication.
Right.
That the more we don't want to talk so much about it that it's the only thing everybody's thinking about. But on the other hand, the more we talk about it, the more people feel comfortable with the facts, because they've heard them so many times.
Yeah.
They've heard enough people say, don't panic, that giving the affirmation of, we can handle this if we do these measures, if we take these steps.
Yeah.
And once you hear it a few times, it does, kind of enter into your consciousness and you feel less anxious. So, it's as much a psychological experiment as it is, a medical issue that we're dealing with. But I think that it's also a spiritual battle that we're fighting as well.
I absolutely think it's a spiritual battle.
And I mean, I think a lot of people are talking about that as well. Just in the Catholic.
I've only been reading the medical stuff, so I haven't been reading the other stuff. But I would say that's a big deal.
Even in like Catholic circles and things like that, there's this like, oh my gosh, this isn't evil. Like, sickness isn't evil. It really is. And what are we supposed to do with that? And I was just kind of reflecting on like other like things that have happened just historically, biblically even, and, like floods, pandemics, where, plagues, all of these things. And what is the purpose? Like, what is the purpose? I would not say, I think that on one side people say retribution, which is, but it's also a call to repentance. It's a call to figure out if we're living our lives the way we should be.
Isn't that Lent now?
Oh, isn't it Lent?
Isn't that weird that we have this during Lent?
Yeah, I don't think that's a coincidence.
Yeah.
And I think that if we do have this mindset that all things happen for God's glory, right? I mean, we have the story in the gospel of the blind man who, came to Jesus for healing, and the disciples who were around Jesus were like, well, what did his parents do that were wrong? What did he do that was wrong? And Jesus said, these things happen so that God's glory
so I can
be
show
shown.
my glory.
So like there are wonderful, beautiful, amazing things that can happen out of like terrible, scary, horrible things, but we have to be open to looking for them as well. And so kind of what we said the last time of, you were saying like, well, you should be doing these things anyway.
But we weren't.
But maybe now we will.
Right.
Maybe
we weren't.
because we're scared now, we will be doing all of the things that we should be doing anyway.
Right.
Because, and that will be for God's glory too.
And even from a medical perspective, tonight in the live stream with all the ER doctors, there were a whole bunch of people who were, they were talking about what's the benefit of this? Like, what is going to be the good that comes out of this? And they said, well, this may not turn out to be as bad as we feared it to be.
Wouldn't that be a miracle?
And look at how much we're preparing, and we're going to be ready for the next thing that comes along in the future. So I like to think about that. How can we find a way to show God's glory through this trial that we have? And I like that idea of repentance here during Lent.
Okay, I'm going to leave with one little Catholic tidbit because, again, this is from that book that I talked about on our last live stream, Searching for and Maintaining Peace by Father Jacques Philippe. And this is, again, by St. Francis de Sales. And he just says, all things contribute to good for those who love God. And as a matter of fact, since God can and does know how to draw good from evil, for whom should he do it if not for those who, without reserve, have given themselves to him? Tell me, please, what could he not do with our afflictions, our sufferings, and the persecutions we endure? If then you are ever touched by some unpleasantness, from wherever it may come, assure your soul that if it loves God, everything will be converted to good.
Amen.
Yep.
Amen. All right.
Bye, y'all.
See you. Good night.